喂，搞咩啊？入咗20分鐘仲唔出嚟嘅？
仲運緊工啊，等多陣啦，就快啦。
運工？你成日便秘，睇下醫生啦。
The second most common problem we encounter in gastroenterology is certainly constipation, and we see this occurring more and more as people get past age 40. There are a number of causes of constipation. Sometimes it can be due to thyroid dysfunction, where the gland is not functioning as well as normally, and it can cause a change in the motility of the GI tract. Additionally, there can be other motility disturbances of the gastrointestinal tract. Perhaps there's a slow movement of the colon. That can be something intrinsic, or it can come from medications that a person is taking. Then occasionally, that motility disturbance involves the muscles of the pelvis and the rectum, where you have somewhat of an emptying disorder, perhaps. We see it also with stress, changes in lifestyle, immobility, and then sometimes it's just side effects from medications. Then we have to think about structural disorders. And when it's a structural disorder, that can be a little more alarming. That can be something like a tumor or scar tissue that occurs after having previous surgeries. Sometimes this can be presenting with different types of symptoms. There may be bloating or abdominal discomfort. In some cases, people will go several-day interval between bowel movements. Perhaps there'll be rectal pain from distension of the rectum as a result of constipation. And then maybe the most common complaint is actually bloating or general distension of the abdomen. So what do we do? Well, first of all, we would recommend that someone consider adequate hydration and fiber intake. And then, if this continues, we recommend seeing your physician. At this point, labs can be done to check the thyroid and some of the other blood chemistries that can contribute to constipation. Imaging may be done as well to try to detect structural disorders that could cause this. A discussion of stress and lifestyle, dietary changes, things in your medications that may be contributing to the problem, all of that may be discussed with your physician. Of course, if there is any evidence or any signs that there needs to be further investigation, you can be referred to your gastroenterologist, at which point imaging and endoscopy may be considered. There's also specialized muscular testing to look for those emptying disturbances as well. But it's very important to remember that not everything with constipation is a minor problem, and this may be a sign of something more significant, perhaps even something that would require a surgical correction. Therefore, we have to always remember that symptoms may be a blessing, and that early detection after detecting symptoms may lead to a resolution that could save your life.